So this PowerPoint, we are going to talk about neurological and cognitive disorders. The first one here, cerebral palsy. So definition say, a disorder characterized by impaired movement and posture resulting from an abnormalities in extrapyramidal and pyramidal motor system. If I make it easy, I want to tell you, cerebral palsy, a group of disorder that affect our movement or muscle tone, affect the balance and posture. This is the impairment, movement and posture, because abnormalities in extrapyramidal system in the brain or motor system defect, right? So the most common clinical type is a septic cerebral palsy, which is represent the upper motor neuron type of muscle weakness. So the sign and symptom generally appears during infancy or preschool year, and even it varies in between individuals. So cerebral palsy is disability, can be one side of the body or affect the whole body, right? So this is less common type of cerebral palsy are ataxia and mixed form. Whatever it is, both cases impaired the muscle coordination or involuntary movement or abnormal or exaggerated reflexes. For some patient present with a slow or slow movement or septic paralysis. This is the characteristics. So data collection said, or sign symptom, extreme irritabilities and crying or feeding difficulties, abnormal motor performance. What next? Alteration of muscle tone or stiff and rigid arms and legs. Delay the developmental milestone or persistence of primitive infantile reflexes or abnormal posturing. Also, seizure may occur. Abnormal posturing, is the most common in cerebral palsies. So not only this, some patient present with urinary incontinence or mental disorder or intellectual disabilities, right? So before to go to the intervention, if you ask me, what are the causes of cerebral palsies? Cerebral palsy is caused by abnormalities or a disruption of brain development. And the problem in the brain development could be due to some reason, like infection during the pregnancy, or some risk factors include fetal stroke or infection or inflammation of the fetal brain tissue, reduced oxygen supply or lack of oxygen to the brain, particularly during the labor or premature birth. how we can prevent the cerebral palsy, right? So a woman should get herself vaccinated for rubella or other infectious disease before planning for pregnancy. This is the one way we can prevent it. Also, visit your doctor regularly during the pregnancy. So what are the intervention? So the goal of management and early recognition and intervention to maximize the child abilities. A multidisciplinary team approach is implemented to meet the many needs of the child. The therapeutic management include physical therapy, occupational therapy, speech therapy, or educations and recreation. Also determine the child developmental level and intelligences. Encourage the early intervention and participation in the school program is encouraged. Also prepare for using a mobilizing device to help prevent or reduce the deformities. What next? So nursing care is important, right? If my patient have this problem. So the nursing goal for a client with a cerebral palsy include optimized mobility and prevent deformities or improve the nutritional status, right? Also, we need support, or we should encouraging patient to self-care. Also, it is good to improve communications and provide quality of life. So next here, encouraging communication and interaction with the child and on his or her developmental age level. Provide a safe environment by removing sharp objects. Using a protective helmet if the child falls frequently, or implementing seizure precursor if necessary. Provide safe, appropriate toy for the child age and developmental level. Position the child upright after the food. Medication may be prescribed to relieve muscle spasm, which cause intense pain, or anti-seizure medication may also be prescribed. Provide the parents with information about the disorder and treatment plan. Also, encourage support group for parents. So sometimes NCLEX board asks, if patient have a cerebral palsy, as a healthcare provider, how we care of the patient. So nursing goal for the client with the cerebral palsy in always in optimized mobilities and prevent deformity is the first priorities. Or we try to improve nutritional status, right? So some books said there are 7 nursing care plan is important, and nursing diagnosis is important for cerebral palsies, right? And what is 7 criteria? Like impaired the physical mobility, find it out. right? So, and also it is important to take care of prevent the falling. So it is very important to prevent the fall. So when we assessment the patient who have cerebral palsy, we assessment for infant for abnormal muscle tone or inability to achieve the milestone, developmental milestone. Also, we reinforce the therapeutic plan and assist the family and also modify equipment and activity to continue the therapy program at home. We always encouraging parents to define their concern or acknowledgement of the concern about their child if they have problem. Now let me talk about the head injuries. They said head injury is the pathological result of any mechanical forces to the skull or scalp, meninges, or brain. So we can see a picture. This is the head. Head is the brain tissue is covered by a layer called meninges. And out of the meninges, we also have a 3 layers of meninges we call pia or pia mater, dura mater, and arachnoid mater. Right? This is the pia mater in inner side, and this layer is called arachnoid mater. In between this subarachnoid mater, right? So the meninges then covered by skull and outermost layer is called skull. So head injury is a broad term that is describe the injuries to the brain, injuries to the skull, injuries to the skull, or injury tissue and blood vessels inside the head. So some head injuries are also called brain injuries or traumatic brain injuries, or sometimes it is called or depends on extent of the head trauma. So open head injuries occur when there is a fracture of the skull or a penetration of the skull by objects. So closed head injury is the result of a blunt trauma, and it is more serious because of chance to increase the intracranial pressure. So the brain, inside the brain, we have a pressure we call intracranial pressure. So everybody know we have a blood, and blood has a pressure over the artery we call blood pressure. And we have a pressure inside the eye, it is called intraocular pressure. So it is more serious because of chance to increase intracranial pressure. So manifest depends on type of injury and subsequent amount of increase intracranial pressure. What next? So in this picture, we can see, if you see this baby's head. So sometime if baby is shaking too much front and back, their brain tissue is damaged in front side and back side, or here showing head is injured in something. So subdural vessels, and here immediate post injuries, right, and the pre-injuries contour of the skull. So mechanical distortion of the cranium during close head injuries. So other head injury we call conclusion or conclusion. It is the type of head injury that is caused by the shock of the brain. Anyway, here showing the client's level of consciousness provide the earliest indication of an improvement or deterioration of the neurological condition. The early sign, slightly change in the vital sign, slight change in the level of consciousness. In case of infant, we will found irritabilities, high-pitched cry, bulging frontally, or increased head circumference. Also, dilated the scalp vein. So in case of child, we can see the headache, nausea, vomiting, or visual disturbance and seizure. So next here, so in case of head injury, particularly because of head injury, if the intracranial pressure is increased, and left side we could see decrease the level of consciousness and also bradycardia, or decrease the motor and sensory responses, and alter in the pupil size and reactivities. So in case of head injury, it is important to know what is decortical posture and what is decelebrate posture. So decorticate posture, it is adduction of the arms at the shoulder, and arms are flexed on the chest with the wrist is flexed and also hand is fisted. So decorticate, so both hands towards the midline, but here both hands away from midline. It is called decelebrate. And here we can see the lower extremities are extended and adducted, but here is abducted. So seen with the severe dysfunction of cerebral cortex. So if the cerebral cortex is injured, or problem with the cervical spine tract or cerebral hemisphere, patient will show the corticate posture. The arms and feet look like the letter C, and decorticate, decorticate, and decelebrate. The arms away from the midline is look like the letter E, and decere, decelebrate. Problem when in the midbrain or problem in the pons. Decelebrate posture, rigid the extension and pronation of the arms and legs. Also sign of dysfunction of the level of midbrain. So if the patient has an injury to the midbrain, we can see the posture is decerebrate. If the injured in cerebral hemisphere, posture should be decorticate. According to see their posture, we can find it out what problem it might be before go for scan or MRI. Also, the respiration is called chant stroke respiration, and also patient develop the coma if untreated. Here we can see both decorticate and decerebrate posture in different angle or views. So in case of head injuries, as a healthcare provider or as a nurse, what are the what we supposed to do? What are the nursing interventions, right? So first of all, I could tell you, so head injury nursing assessment, always we go and check first Glasgow Coma scale. It is called GCS assessment, the conscious level of the patient. You can find it out. Also, we can see the symptoms of increased intracranial pressure or not. Also, we care the plan on head injuries or nursing care plan of head injuries, always including nursing diagnosis, right? Intervention, and also rationale. So they said that immobilize the neck and spine after head injury if a cervical or other spinal injury is suspected. When a spinal cord injury is ruled out, elevate the head of the bed 15 to 30 degrees, and if not, contraindicated and as prescribed. Monitor the airway and administer oxygen as prescribed. Also, check the injuries. Position the child so that the head is maintained. The midline avoid the jugular vein compression, which can increase intracranial pressure. Also, monitor the vital signs and neurological function. What else? Notify the primary healthcare provider if the sign of increased intracranial pressure, or keep the stimuli to a minimum. Attempt to minimize the crying. Also, sedation medication are withdrawn during the acute phase. Initiate the seizure precursor, very important. Monitor, decrease the responsiveness of pain, or maintain NPO status to provide a clear liquid if prescribed until it is determined that vomiting will not occur. Important. Next here we said the seizure precursor is important if we say the patient have a head injuries, right? So raise the side rail, also pet the side rail, or place the waterproof mattress or bed on the bed, or instruct the child wear or carry medical identification bracelet. Instruct the child in precursor to take during potential hazard activities. Instruct the child to swim or instruct the child to use a protective helmet. Also, alert caregiver to need for any special precursor. So what next? What are the next intervention? So always our diagnosis is important for intervention, right? So diagnosis based on assessment data, as you know, right? So assess the monitor prescribed intravenous fluid carefully to avoid increase any cerebral edema. So we give them fluid because if patient is nothing by mouth, electrolyte imbalance will be occur. Prevent it, we give IV fluid. But it is important to calculate the right doses. Otherwise, too much fluid can cause cerebral edema or pulmonary edema. We have to monitor the vital sign regularly. Monitor for fluid and electrolyte alterations, or check the wounds and dressing for presence of drainage, and monitor for nose and ear drainage, which could indicate leakage of cerebral fluid, shortly called CSF. So if we see something abnormal, it is important to note it and notify the register nurse immediately or the supervisor. Assist to administer the tepid sponge bath or place on a hypothermia blanket as prescribed if patient have a hyperthermic occurrence. Right? So in a short, I want to tell, so if we can see ineffective airway clearance or impair the gas exchange related to the brain injuries, is important to evaluate. Also, ineffective cerebral tissue perfusion related to increase the intracranial pressure need to evaluate. Also, deficit the fluid volume related to decrease the LOC or hormonal dysfunction we need to evaluate. Also, imbalanced nutrition or less than body requirements related to the metabolic change or fluid restriction and inadequate intake, everything we need to evaluate. What next? Avoid the suctioning through the near because of possibilities of the catheter entering the brain through the fracture. As prescribed, assist to admin medications such as acetaminophen, so-called Tylenol, if patient have a headache. Anticonvulsant for seizure. Antibiotics if laceration is present, like head injury, brain trauma. Also, corticosteroid or osmotic diuretics may be prescribed to reduce cerebral edema. Monitor for sign of brainstem involvement. So here a few more information about head injury, particularly what are the sign of brainstem involvement. So what are the sign of brainstem involvement? So here, let me tell you, deep, rapid, or intermittent collapsing respiration, right? If any, we call. So brainstem, which part of the brain we call the brainstem, right? So brainstem, actually the three major parts together we call brainstem, like midbrain, pons, and medulla. So if the injury occur in the medulla or pons or midbrain, we call brainstem is get involved. We can check the wide uh, fluctuations or noticeable slowing of pulse, widening pulse pressure, dilated unequal pupil. Also notify healthcare provider immediately if this sign develop. What next? So we could monitor the sign of epidural hematoma, like asymmetrical pupil may indicate neurological emergency that requires evacuations of hematoma. Also notify the RN immediately if this is noted. NCLEX board asks a questions about this, we call NCLEX tips. So drainage from the nose or ear must be tested for presence of glucose. So drainage from that is positive for the glucose indicate leakage of CSF. Frequently asking question in NCLEX board. The registered nurse or primary healthcare provider must be notified immediately if drainage test positive for glucose. So now let me talk about hydrocephalus. So what is the definition of hydrocephalus? An imbalance of CSF absorption and production caused by malformation, tumor, hemorrhage, infection, or trauma. So hydrocephalus, a condition characterized by excessive fluid build up in fluid containing cavities of the brain, which result in the developmental, physiological, or intellectual impairment, right? And result in the head enlargement and increase intracranial pressure. So hydrocephalus types, one is called communicating and non-communicating. What is communicating? It does mean hydrocephalus occur as a result of impaired absorption within subarachnoid space. Also, interference of cerebrospinal fluid in the ventricular system does not occur. And non-communication here, obstruction of the cerebrospinal fluid, right? Fluid flow in ventricular system does not work. So what can cause hydrocephalus? So either congenital or acquired. Hydrocephalus is caused by condition that is affect CSF movement. And the trigger could be premature birth or neural tube defect or enlarged ventricles. Also, ventricular hemorrhage can cause, or trauma, brain tumor, infection, surgery, and health condition that is impair the blood flow. What next? So what are the signs and symptoms of hydrocephalus? So they said in case of infant, increase the head circumference. Head is bigger than the normal. And thin, widely separated bones of the head that is produce the cracked port suture. Anterior frontal that is tense, bulging, and non-pulsating. Suture will separate it prior to frontal bulging. Dilated skull and frontal bossing means this area is swelled up. And also setting sun eye. You can see it is called setting sun. So here we can see CSF accumulate in ventricles. CSF build up in ventricles, blockage the CSF flow, hydrocephalus. So the commonly noted the symptoms of hydrocephalus in children or patient. We can see patients sometimes complain of chronic headache, nausea, difficulty of focusing the eye, or difficulty of walking, or weakness in the legs, also seizure. So here talking the child, behavioral change, irritabilities, lethargy, headache, or nausea, vomiting, ataxia, and nystagmus. In late stages, a high or cry and seizure. This is the most important, right? So if it is untreated, can cause so many complications like dementia or fall due to difficulty of walking or difficulty of control the balance. So it is important to intervention. So here talking the goal of surgical treatment is to prevent further CSF accumulations by bypassing the blockage and drainage the fluid from ventricles to location where it may be reabsorbed. In a ventriculoperitoneal shunt or CSF drain into the peritoneal cavity from the lateral ventricles. In a ventricular shunt, the CSF drain into the right atrium of the heart from the lateral ventricles or bypassing the obstruction, and this is used for older children and those with pathological condition of the abdomen. Shunt reverse may be necessary as the child grows. An alternative to shunt placement is endoscopic third ventriculostomy, or in which a small opening in the floor of the third ventricle is made that allow CSF to bypass the fourth ventricles and return to the circulation to be absorbed. This treatment may not be appropriate for some type of hydrocephalus, right? So surgical management is one of the options, or surgery to insert the tube we call shunt, or to treat the condition that block the pathway for free flow of CSF is the generally recommended treatment options. So in case of hydrocephalus, we can say ventriculoperitoneal shunt. As I told you, so surgery to insert a tube called shunt, ventriculoperitoneal shunt, or to treat the condition that blocks the pathway for free flow of CSF is the generally recommended treatment. It will be help to out the fluid drainage. In case of hydrocephalus, what is pre-operative intervention, post-operative intervention, right? So nursing care is important. What is pre-operative? Monitor intake and output. Administer small frequent feeding as tolerated until a preoperative NPO status is prescribed. Or reposition the head frequently and use special device such as an egg-grade mattress under the head to prevent the pressure sore. Prepare the child and family for diagnostic procedure and surgery, right? So again, nursing intervention is very important for the patient in case of hydrocephalus. What are the post-operative? So hydrocephalus affect 100 to 1,000 Americans, right? So in every stage of life, from infant to elderly, I said 1,000 to 100 American get attacked. Like hydrocephalus. Hydro means water. Cephalus means head. Water inside the head, right? Hydrocephalus can be defined broadly as a disturbance of cerebrospinal fluid, right? So monitor the vital sign important, then neurological sign, maintain input-output chart, position of the child on the perited side to prevent the pressure, keep the child flat, observe, increase the intraocular pressure, measure the head circumference, also monitor for the sign and infections. What else? What next? So next here, provide the comfort measure and also assist the administer medication as prescribed. So reinforce the instruction to the parents regarding how to recognize the shunt infection. So keep it note the nursing management, including educate or teach the family about the management required for the disorder or hydrocephalus. So in an infant or irritabilities, a high shrill cry, lethargy, feeding, poor may indicate shunt, malfunction, or infection. So the major complication of the shunt are infection and malfunction. And other complications include subdural hematoma or caused by the too rapid reduction of CSF, or can develop peritonitis or abdominal abscess even. And also in a toddler, headache and lack of appetite are the earliest common Sign of shunt malfunctions. In older children, most valuable indication or shunt malfunction is an alteration of child level of consciousness. Also, if patient is cry is an infant can be the sign of increased the hydrocephalus.